going to discuss some of the nutritional problems now. And the first one, again, these will lead to weight problems. And the first one is going to be protein energy malnutrition. We used to call it kwashiorkor. This is not enough calories. Okay. And we get calories certain ways. And in this case, we're not getting enough calories. We're also not getting enough protein, either because you're not getting enough in or you're losing it because of malabsorption or whatever. Typically, protein energy malnutrition will manifest itself after weaning from the breast. If the mom is properly fed, the baby will be getting good nutrition, and the baby preferentially gets good nutrition through breast milk anyway, and it's when they wean off the breast and now they may not have other sources of proteins and calories that you start to manifest. A lot of these diseases will occur once they wean off the breast. Another one, for example, would be the zinc deficiency, and that one we call acrodermatitis enteropathica, where they have lesions around the perianal area. Usually these occur with weaning from the breast. Early on with protein energy malnutrition, the baby will develop some lethargy. They can also become apathetic and irritable. On physical exam, you'll see decreased subcutaneous tissue. They will become somewhat hypotonic because of decreased muscle tone, because now they're breaking down their own protein. They can have edema because remember that albumin is a protein. Albumin helps to maintain oncotic pressure. If you have protein malnutrition, you're losing your protein, you lose your oncotic pressure, and so you develop edema. They develop a characteristic dermatitis, and they can have this thin, sparse hair. It's not only in developing countries. I remember taking care of a child that was actually a child with special needs, and there was a form of child abuse. This patient was not being fed, was approximately 14 or 15 months old, and weighed about 14 pounds. So that's a question you can get. Remember how much weight they gain in the first year of life. Well, obviously that was inappropriate weight gain. This child was being abused by the parents, so that could be a manifestation. Labs will show some hypoproteinemia in the lab work that you do, and hypoalbuminemia, and also you can have, with the labs, you can look for prealbumin being low. The treatment is going to be slow refeeding. You don't want to give them a ton of calories all at once. You have to work your way up slowly. Here's a patient with kwashiorkor, or protein calorie malnutrition, and you can see that there's a lot of wasting going on. The baby's muscle tone isn't very good. Obviously the ribs, and you can see how bloated the belly is, and that's a lot of times just because of edema. And look at this baby that's sitting down. Look at his feet. Look at the edema. See how puffy those feet are? And that's because of the hypoproteinemia. The opposite end of the spectrum is obesity. Look for a family history. Typically, it runs in families. A high birth weight can correlate with obesity. However, not every high birth weight child grows up to be overweight. Later onset of obesity is a very good predictor. The older you are when you start to become obese, the more likely it is that you will be obese. And unfortunately, in this country, we're starting to see a lot of obesity in children. And it leads to complications, the same complications you can see in an adult. So that children who become obese are at higher risk for type 2 diabetes, and we're actually seeing an increase in that. Children who are obese, there's a higher risk for hypertension and all the complications of obesity. Obviously, lifestyle is very important. If we're eating too much and not exercising enough, that leads to obesity. The diagnosis is going to be made with body mass index. So you don't need to know the formula. They will probably just give you the number. Greater than 95th percentile body mass index, or 95%, is going to be considered obese. If you're between the 85th to 95th percent, then that's considered overweight and at risk for obesity. And another quick measure is if your body mass index is greater than 30 kilograms per meter squared. So that's an actual number. The others are percentiles. Greater than 13 years of age, that's obesity. The treatment of obesity, the etiology of obesity is mostly considered exogenous. Very few syndromes course with obesity. We already mentioned Prader-Willi as one, for example, but most people who are obese, it's exogenous. Certainly patients with tall stature, an advanced bone age, these all can be seen. as a result of the obesity, and they can also develop slightly early puberty. And we do see as complications type 2 diabetes and hypertension. The treatment is obviously going to be education, counseling, prevention of obesity, diet, and proper nutrition. We're going to go over a few vitamin deficiencies now. These are all nutritional problems, which may or may not be seen here, but may or may be on the exam. So vitamin A deficiency is very important for us so that we can see, and it can cause a night blindness. They can also have a dry, scaly skin with vitamin A deficiency, and this is some of the ocular lesions. The arrow points to Bitot spot on the top picture. The arrow in the other bottom picture points to a corneal cirrhosis. Obviously, it's from inadequate intake of vitamin A. Vitamin B1 causes beriberi, and this can cause a neuritis. That's why this patient is on crutches right now, because of the neuritis. It can also lead to heart failure, and you can see here dependent edema secondary to heart failure. The heart failure is, with beriberi, is a high output heart failure, and patients can have an encephalopathy from it. Niacin causes pellagra, and it's the D's disease, diarrhea, dermatitis, which is worse on sun exposure. That's what you see on the drawing and the picture. It can cause dementia and actually lead to death. So it's disease of D's. Vitamin C causes scurvy. In the old days, the British sailors were called limeys because they learned early on that scurvy was a vitamin C deficiency, and so they would take citrus fruits with them, particularly limes, and that's how they got the name limeys. So if we can replace vitamin C, you can avoid scurvy, and they can get a pseudoparalysis. They describe what's known as the scorbutic rosary, which are these little lesions right here, like rosary beads on the ribs. And they can also have mucous membrane hemorrhages, which are shown there, the arrows by the teeth. Vitamin D can cause a type of rickets. It can also cause tetany. Vitamin D, remember, one way of getting vitamin D is sun exposure. Otherwise, you can have vitamin D supplementation. And here you see the bowing, both in the X-ray and in the child, that you can see with rickets. And here you see the bottom part of the femur as it forms this little beak right there from the bowing, and then you almost get like a compensatory on the other side.